Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on a medication called clonidine. And we're starting right now. Just keep in mind that this channel is for information purposes only. So to start this presentation, we'll discuss what this medication is used for. So clonidine treats high blood pressure and ADHD, along with some other off-label indications. Now, how to use this medication. So first off, take your medicine as directed. Your dose may need to change several times to find what works best for you. Swallow the extended release tablets whole. Make sure you do not crush, break, or chew it. Clonidine extended release tablets work differently than clonidine immediate release tablets, so do not switch from the extended release to the immediate release unless your doctor tells you to. Measure the oral liquid medicine with a Merck measuring spoon, an oral syringe, or medicine cup, and make sure you shake the bottle well before each use. What happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, wait until then and take a regular dose. Do not take extra medicine to make up for a missed dose. Now for this particular medication, if you miss more than one dose, it's a good idea to check in with your physician. This medicine should come with a medication guide, so be sure to ask your pharmacist for one if you didn't receive one when picking up your prescription. We'll now discuss some warnings for clonidine. So tell your doctor if you are pregnant or breastfeeding, or if you have kidney disease, heart or blood vessel disease, heart rhythm problems, stomach or bowel problems, or a history of heart attack or stroke. This medication may cause dry eyes, so talk to your doctor or pharmacist about how to treat the dryness. This medication may make you drowsy, dizzy, or lightheaded, so do not drive or do anything that may be dangerous until you know how the medication affects you. Be sure not to stop using this medicine suddenly. Your doctor can work with you to decrease the dose slowly. And tell any doctor or dentist that you are using clonidine because you may need to stop it before surgery or tests. And the last warning here, even if you feel well, do not stop taking clonidine without consulting your doctor. This medication will not cure your high blood pressure, but it will keep it in a normal range. Some patients remain on blood pressure medication for the rest of their lives. Over the next two slides, we'll go over some adverse reactions or side effects. For these ones here on this slide, if you experience them, you would want to get in touch with a physician right away. So if you have an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing, if you have a fast, slow, pounding, or uneven heartbeat, if you have lightheadedness, dizziness, or fainting, swelling in your hands, ankles, or feet, or unusual tiredness or weakness. For these side effects here, you would just want to mention them to your physician at your next appointment or to your pharmacist when you're picking up your prescription. So mild constipation or stomach pain, dry eyes, mouth, or throat, a mild skin rash, or new or worsening headache. All right, everybody, that's all we're going to talk about today with clonidine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.